Little's area. The nose has an extremely rich blood supply with contributions from both the internal and external carotid arteries. Vessels from both these sources anastomose extensively within the nasal cavity, including the lateral wall, the septum, and also across the midline. The Kieselbach plexus, or Little's area, is the most frequently associated anastomotic site for epistaxis and is located on the anterior cartilaginous septum. Woodruff's plexus is a confluence of vessels on the lateral wall posterior to the inferior turbinate and is often implicated in posterior bleeds. The external carotid artery's contribution to the nasal cavity is via the facial and maxillary arteries. The superior labial artery is one of the terminal branches of the facial artery, and it supplies the anterior nasal septum. The lateral nasal artery and ascending palatine artery are two further branches that supply the nasal vestibule and a small area of the nasal cavity. The maxillary artery supplies the nose via the greater palatine branch to the anterior nasal floor and septum. The sphenopalatine branch of the maxillary artery is the most recognized and is a significant contributor to the vascular supply of the nasal cavity. It enters the nasal cavity through the sphenopalatine foramen and then divides into posterior, lateral, and septal branches. The lateral branches give rise to the arteries for the middle and inferior turbinates, whilst the septal branch supplies the posterior septum and then terminates in the Kieselbach plexus anteriorly on the septum. The internal carotid artery contributes to the nasal vasculature through both the anterior and posterior ethmoidal branches of the ophthalmic artery. The larger anterior ethmoidal artery and the smaller posterior one run below and above the superior oblique muscle, respectively, and exit the orbit through their named foramina. They both cross the ethmoid roof and enter the nasal cavity through the cribriform plate and then divide into branches to supply the lateral nasal wall and nasal septum.